We are now recording the session, and by recording it, we're able to put it up on YouTube and put the link on the website that we put together so that folks who are here on the call can go back to it and reference it, but also others who, for whatever reason, may not be able to make it are able to see what's happening. And we do have a couple of other board members there. Dr. Carenti, if you would look for Ms. Richardson and Ms. Parkhill. Thank you. Great. And so, what we didn't do either is rename ourselves. So why don't we go right in and do that? There we go. Okay. So thank you for joining us on a Friday afternoon. I know it's not the most opportune time for a webinar on COVID operations guide and a Q&A session, but we feel this is very important information and wanted to be sure we could do this with you before the week was out. You may have seen the schedule that went out with email on Sunday. It's been a pretty aggressive schedule with 2 or 3 of these webinars with our schools and our staff each day this week. And so we truly saved the best for last here with our high school parents and guardians in our group. In a moment, I'll give our panelists an opportunity to introduce themselves. And in the meantime, if you have a chance, panelists, if you know how to rename yourselves, it may make it a little bit easier for our folks on the call. If not, we'll go through and do it for you. If you don't have a system that can do that, it's easy for us too. But I do want to say thanks to the 191 now people who are who've joined us, and hopefully more will be able to sign on as well. One of the advantages to being the final group in our conversation is that we've learned quite a bit about using this platform and how to use it best in a large group environment. So one of the things we've learned is to ask you to hold off on your questions until we get to the question and answer period of our time together. And the reason for that is I'm going to be covering a lot of ground in the overview. I'll do it as quickly as I can, but there's quite a bit to cover. So we'll be running through that information here. And so if you ask questions before I finish, and then I wind up talking about your question, we don't know if your question is because we need to go deeper into something or simply because you asked it before I talked about it. So if we wait, then we know that all the questions there are things that we need more information on. Another thing about the Q&A function here in the webinar is I'm going to go in and do it now, make sure that it is happening. There we go. I'm going to allow everybody to see all questions, and I'm also going to set it up so that people can upvote each other's questions. So what the system does is when a question gets upvoted, it moves it up to the top on our side so that we can see what the highest priority questions are. So prior to asking your question, if you could take a moment just to skim through what's already there. If it's close to what you wanted to ask, just upvote it for us, and that will increase the odds that it comes to our attention, we're able to answer it. At the end of our session together, we'll be copying and pasting all of the questions, and we'll put it towards the Q&A document that we're building that will be directly on the website. We'll have that out mid next week. And that'll also become an evolving source as questions come in we think that are good for everyone to be aware of. We'll make sure that we continue putting it up there. All of you should have gotten here, I think, through that website, which I'm happy for, and I want to share that. Again, the philosophy of building and publishing that website was so that we have one source for you to go to at your convenience when you're ready and interested in getting an update. So we will work, we strive to keep that updated as much as we can. A couple times a week at the very least. Things are happening very quickly. As a matter of fact, the conversation we're going to have today is a bit different than it would have been if we had the conversation on Tuesday because of things that have changed throughout the course of the week in Hartford and the guidance that we've been receiving from them. You should know that just today I've been on calls with the commissioner for several hours, as a matter of fact, talking about a number of different things. We're receiving emails every day with updated information. So the information flow from Hartford has been excellent. Even on Monday, Governor Lamont came to New Canaan High School. We got together in the Wagner room with Governor Lamont, myself, and 8 other superintendents from the region. We socially distanced, we sat down, we closed the doors, and we had a true conversation about what was going on. And then that 4 o'clock press conference that happened that afternoon, Governor Lamont talked about flexibility for districts. And that was really the really what we focused on in our conversation with him, that we need the guidelines at a high level around levels of community spread and using the epidemiologists and others to help guide our decision making. But when it came down to our decisions, we needed the flexibility to make the right decision for our school community based on our local factors and where we are and who we are. Governor Lamont heard that loudly and clearly, and in that press conference went ahead and gave us that flexibility, and that's been a source of conversation ever since. So again, if we had this conversation on Monday afternoon, it would be very different. So I'm glad that the high school is here, where we are on a Friday afternoon. I'm glad you're here with us. So with that, why don't I, our approach is I will give an overview. I'll share my screen with you for a bit, give an overview with some highlights from the document itself, and then we'll open it up to Q&A and go through that. But before I do, why don't we just quickly introduce ourselves, and we'll start with our Deputy Superintendent.
Good afternoon. Thank you for being here this afternoon. I'm Jill Crenty, the Deputy Superintendent. Go ahead, Bill.
I am Bill Egan, High School Principal. I wasn't sure who sees what order.
I'm Christy Queer. I'm one of the assistant principals at the high school.
Ari Rothman, one of the other assistant principals at the high school.
Hi, Katrina Parkhill, Board of Education.
Hi, this is Deanna Carlson, Board of Education.
Hi, Julie Reeves, Board of Education.
Jennifer Richardson, Board of Education.
Okay, that was almost in order on my screen. Did we get everybody? All right.
I think so.
Yeah, okay. Excellent. So now I'm going to go ahead and share my screen, and we'll just use this to guide our conversation together a bit, and then we'll get into the Q&A. And again, we're using the webinar function for a couple of reasons. One being that it is a great way to have several hundred people on a call together and to manage that. It does mean that we can't see you. You have the benefit of seeing my fellow panelists, and I'm sorry you have to suffer through seeing me, but we found that it's a great way to sort of manage the conversation a bit. And if you've been to our Board of Education meetings, you'll recall we used a similar function as we use the webinar function there as well. So let me get right into it. I know, again, the sun has come out and it's Friday afternoon, so we put an hour aside for our time together here. First things first, the state required us to put together a plan and to submit that plan to them by Friday afternoon. And that certainly sort of kicked off our articulation of our planning, but our planning began all the way back, really from the moment we closed. We started planning and how can we safely reopen, how can we bring our kids back and run our schools. So the state asked us to put together a reopening guide, but we're not calling it a reopening guide because we feel that there's a lot more to it than that. This is actually an operations plan, operations guide, because we recognize that for as long as we have to make decisions that factor in the pandemic, then we want to make sure that we're clear in articulating how we'll get to those decisions, what strategies we'll be using, and what guidance we're giving for everyone. To call it just a reopening guide or reopening plan just didn't seem to really capture the complexity of the thinking and the work that's required to do this well and successfully. And I do want to just quickly compliment our, really the whole staff, the whole district, everyone on this call and beyond. If we go back to what we experienced in the spring, we, based on local metrics and conversations with the EOC and others, we made the decision on March 11th to close our schools. And by March 13th, we began teaching remotely, and not just giving worksheets, but really working to continue the progression of learning for our kids. Over time, as that extended out, you may recall we were one of the first, if not the first districts to close. And then we were the first district to say, we're going to be closed through April 20th at the earliest. And then, and we did that. And then the next day, the governor closed the schools for that long. And then ultimately we wound up closing for the year. Over the course of that time, we learned quite a bit about the virus, about the health and safety measures. We learned about teaching remotely and working on live streaming and what have you. We'll get into that in a little bit. But I raise that point because I want to reiterate the fact that we are a part of a statewide system, but we also work to ensure that we maintain the flexibility to make local decisions based on our local conditions and with the guidance and support and knowledge of our local experts. That's really important. So we will always prioritize health and safety first and foremost above all else, and we'll make our decisions based on that. And again, the governor's announcement just recently, it reaffirms that for us, that is our purview. And it's a tough charge, you know, sure, it'd be easier if everyone just told everybody else what to do, but it's the right thing because we want to continue to lead our community forward in all of what we're going through and experiencing. And we need to use the collective wisdom and experience of the many, many experts that we have who are contributing. Regularly, I have the opportunity to speak with Dr. Reed, who works over at Stanford Hospital in surgery and is very connected with everything happening there. Dr. Pierce, who is a pediatrician in town, who's connected with Norwalk Hospital and the whole New Advanced Health system. I'm on the phone often with Commissioner Cardona from the Department of Education. Just Monday, after the press conference, I was on a call for a couple of hours with epidemiologists from Yale, from UConn Health, with people from the Department of Public Health, with environmental scientists, with local health department folks and others as part of a small task force that's working to articulate the metrics. I'm representing superintendents on this force, articulating the metrics for community spread and for decision making at a local level based on a variety of different data. So we've been very involved with this from the beginning. I think our work has shown that we are really tirelessly working to keep up with the information in the news as it comes, and to make sure that we're making the right decisions for our kids, for our staff, and for our community. So I think that's something that I wanted to mention, but also it's reflected right away, even right on our cover. Every district was asked to put together a guide. We put ours together just like everybody else was, and I've looked through many of the others, and everyone's done an impressive job in building their guides, and everyone has a nicely framed picture of their logo on the cover. We have kids on our cover because that's where our hearts are. That's why we do what we do. You know, we've dedicated our lives to educating children and helping them to grow and mature and move on to bigger and better things. And so we wanted to be sure that our values were continue to be reflected in the document throughout. So, so again, I just saw that a hand raise just popped up. I'm going to cover quite a bit of ground here, and then afterwards we're going to open it up for questions and answers using the Q&A function. And we just ask to hold off on the questions until we get there. Okay. So that's why we call it an operations plan, not a reopening guide, because this will continue to inform our decisions as we move through, and we educate children in a COVID environment. So we do that. We also are keeping this document in draft because as we learn more, we need to continue to be nimble in our decision making and our planning and update our approach based on what we continue to learn. So our values and beliefs, the very first bullet is that we will continue to promote the health and well-being of our students, our staff, all of our community in all domains of their lives. We'll make decisions based on student health and wellness first. Staff health and wellness first. We must do that. And we've always said that, and I think that our actions over the course of this pandemic have truly shown that. The next, of course, is to continue delivering high quality instruction to all of our kids, regardless of modality. And I'll explain what that means in a moment and get into those details there. I'm not going to read this to you. I'm sure there's a collective sigh of relief there, but I just want to pull a couple of highlights out. And of course, we're open to talk about anything afterwards. All of this comes directly from the guide. The state's guidance in alignment with the CDC and the AAP all speak about mitigation strategies. And the approach that Connecticut is using is very similar to the approach that's been used successfully in Europe and Asia, and then those countries that have managed to control the spread well. And the idea here is that these mitigation strategies form a protection around a classroom and around a school, that any one individual strategy in and of itself is not enough. It's really the collective efforts that matter. And we know, and we've seen this from the beginning, and this just the nature of pandemics, there's not a silver bullet answer that's going to solve all the problems. We're not going to be in the midst of a pandemic on Monday and out of it on a Tuesday because something happened. This is something we have to continue to work through, and we've got to understand these mitigation strategies and commit to applying them in and out of school in our lives, all domains of our lives, to help ourselves and each other to remain healthy. So we know ultimately it's going to be the cumulative impact of our collective efforts that determines the outcome, our own public health and how we do. So these mitigation strategies, the first in the guide and the first, again, what we've learned is around cohorting. And the idea of a cohort is you take a large group like a school and you figure out the smallest unit of measurement that you can create, and you keep those students together in the cohort. Now, a high school poses particularly challenging dimensions of cohorting, right? First of all, we know adolescents. Spent quite a few years as a high school principal and know them pretty well. Have two of my own. The high school kids are social animals. And so that's one thing, is what happens outside of the school day makes cohorting a little more difficult. In school, our programming is more difficult. Certainly it's easier to do it in elementary school, even in a middle school where you have the teaming model, but in high school it's a little different. So one of the ways to reduce the number of cohorts that our students are participating in on any given day is to move by the high school to a block schedule. So instead of moving through 7 periods a day and more of the hallway traffic, a block schedule has fewer classes for longer periods of time with fewer transitions in the day. So that's beneficial to the cohorting model. But there are other mitigating strategies that will be applied across the board. Another is the social distancing. So CDC talks about social distancing at 6 feet. AAP, the American Academy of Pediatrics, uses 3 feet as a guide. The Connecticut Reopen Guide uses both, but says really to the extent possible, with a recognition that each one of these in and of itself isn't the answer, but that these things are all used in combination. So we've gone through our classrooms, we've removed furniture where we could, we've asked teachers to take home their personal items, we've rearranged things so that we could work to maximize the potential for social distancing within the classroom. On top of that, we have face coverings that our students and staff are expected to use in the building at all times. So all students, all staff are expected by the state to wear face masks throughout the day. So what we do is we build in mask breaks. Those breaks could be opportunities to go outside and be socially distant and take mask off for a period of time. Inside, if the social distancing is maintained, there are opportunities for mask breaks. And even with that social distancing, we'll have face shields that are available for kids, so that if they are taking a break, still socially distant, but another layer of protection, the face shield could be helpful. We are working with our town, who's been incredibly helpful and generous in sourcing the PPE and the needs that we have. We would hope that students would bring their own mask, but we'll also have them if they get lost or dirty or something else, so that we'll make sure that students are provided what they need. The face mask, and in other places around the building, I should share, we also have shields, right? Plexiglass that's being installed where it makes sense. Because as we look at our buildings and we think about what we're endeavoring to do here, we're looking to take spaces that were designed primarily for collaborative learning and trying to figure out how to socially distance in spaces that are designed for collaboration. So that's a challenge, and we don't want to change our program so dramatically that we don't have collaborative learning occurring in places where appropriate. So that's where plexiglass can be used. So with the plexiglass and the mask and the layering of these strategies together, we maintain the health and safety of folks. Harvard Global Health Initiative came out with a paper, I think yesterday, day before, that talks about developing pandemic-resistant schools. And really, we're using those guidelines as well. Though that was very informative to the state's recent guidelines that were published yesterday around determining level of spread. So all of this, we continue to learn and evolve in all of it. But these practices continue to be reinforced as the best and right practices to apply across the board in schools. The next is something that we've probably been told all of our lives, probably one of the first orders we ever got directly from our parents as children, which was wash your hands. It turns out that's one of the most powerful, most successful strategies in managing this. So providing opportunities for students to wash their hands and making it easy for them to access hand sanitizer and other things and when they can't go in and actually use soap and water. So we've installed hand sanitizer stations all over the school, and we have some larger units going in those more common areas. That's something, things that are similar to what you might find in an airport. 6 or 8 different stations around a kiosk kind of thing where you can walk by, take what you need, and keep going. It's best to use soap and water for 20 seconds if you do it correctly, but we want to make it as easy as possible for people to be able to do this throughout the course of the day. So that's another very important thing. Again, these mitigation strategies layer one onto the next. The last here is this daily monitoring and staying home with feeling ill. And this is something that we're going to be talking about and reinforcing as often as possible with our students, with our staff, with our parents, that you know, it's really important if our students aren't feeling well, that they take the day and don't come into school. Now, we know what's happened in the past is that they come in even if they're not 100% because they don't want to fall behind. They don't want to miss a quiz or a test. They don't want to miss a lecture. They want to be a part of the class. They don't want to miss and have to make it up. So in the system that we've developed around modalities of teaching and our instruction going into the new year, we've really thought hard about how do we reduce the friction in this decision? How do we make it so it's easy for students to stay home if they're not 100% and still keep a pace with what's going on in the classroom, so they don't feel they don't have to make that choice between going in or falling behind. Because we know our kids, we know our students, they want to be there, they don't want to fall behind. And there's plenty of times where they might be 95%, you know, where they would have in the past come in and been just fine. We want them to make a different decision now. We recognize that as we go into the fall, it's allergy season. You know, there are lots of things that are going to be going around, but we want our students, if they don't feel well, to feel comfortable staying out and not feel that it's going to cause them problems. So in the system I'm going to talk about momentarily, you'll see how we've accounted for that. And of course, even the list of symptoms changes. And so we work to keep us updated along the way. Bottom line, we're all in this together. These mitigation strategies will be implemented regardless of level of community spread. We're going to be implementing them as long as we are in yellow, orange, or red. If we get to green, which means we're good to go, then we would look at scaling down the mitigation strategies. But between now and then, they will be in place across the board in our schools. And we really do hope that it's not just for the time that kids are in our schools, but that really reinforcing the importance of hand washing and mask wearing and all of these things, that it helps our students to be more comfortable doing this outside of the school day as well. So the model that we've built, it really looks at 3 different modalities of instruction. In a moment, you'll see what I mean when I say that regardless of modality, everything's a hybrid, but I'll get there in a moment. The model really looks at 3 different levels. It's low community spread, moderate community spread, or high community spread, yellow, orange, or red. And just yesterday, the state published some definitions around that and some metrics that they'll be using to identify. For instance, low community spread in part is fewer than 10 positive cases in the state, in the area per 100,000 people. So as I understand it right now, in Connecticut, we're at a 2. Which tells me that if we were to open tomorrow, we would be opening in a low community spread environment, which would be the yellow. That above 10 and below 25 per 100,000 would generally put us into the orange, and 25 and above would put us into the red. That's one metric. There are others that sort of factor into the decision making, so I don't want to oversimplify it, but I'm giving that as an example because one of the guiding principles around the model is it must be fact-based. We have to base our decisions on the data and the facts. By having a system that's clearly articulated in advance of the experience, then we help to make sure that we're making logical, fact-based decisions and not sort of emotional knee-jerk decisions. So we've worked hard to build a model that does that. The model also is meant to be fluid, and by that we mean education is compulsory in the United States, has been for a long, long time, public education. The attendance has also been compulsory, physical attendance in the buildings until this year. So families can opt into the remote learning program. And there's a whole host of reasons why they may choose to do that, their individual circumstances. If families choose to do that, then they will be participating in the remote learning program while others are in the yellow in the face-to-face program. At the same time, I mentioned before, we have students who may not be feeling well on any given day, who may be out for a short period of time. We may also have students who may have a family member who tests positive, and that student may need to quarantine for a period of time. We want, again, to reduce the friction in that and make sure that it's easy for students to be out, keep learning, still be connected, receive credit for what they're doing, and not fall behind. So the live stream system I'm going to talk about momentarily permits all of that. And so that fluidity between the model exists for, regardless of which one we're in for the most part. And because also if somebody opts into the remote learning in the beginning, a couple of days in, might feel more comfortable, might decide that you want to start coming in, and for face-to-face learning, we need to be able to account for that as well. Again, we're public schools. We want everyone to come in who's comfortable doing so. So if you can change your mind, I guess is the point. The model is flexible in that we know what we know, and we're building the model around all of that. We learned a great deal after the closure in March, and we're using all of what we've learned to develop what we're planning for the fall. But until you actually get boots on the ground and implement a system, you don't truly know it inside and out. So the system's being developed to be flexible enough to adapt. So as we learn more, we can make those changes and implement that. As a system, one of our core values is continuous improvement, and this allows us to continue doing that. The last is fast. We have to be able to quickly move between modalities. Last year, I mentioned March 11th. We saw what was going on. We were able to close on the 11th and flip into distance learning by the 13th and get up and running. We could do that because we prepared for over 2 weeks prior to that day, getting things ready. As you may recall, we even had the 2-hour delay on the Monday of that week to work through some of the final details, to give teachers some time to plan, and to get some materials into kids' hands as they went home. That Monday, plus the other couple of weeks before, as we were looking at everything, really empowered us to make those decisions and to flip right in. Some of my colleagues, unfortunately, were in a place where they had to run school a couple of days longer when the metrics and things were saying maybe they shouldn't. We didn't have to do that because we prepared. We won't have to do that because we are preparing. So the idea is that when the metrics say we need to move into a different modality, we need to be ready to do it and do it, and we will. And then when we're ready to move back into a different one, we will. You know, that's the model, that's the goal, and that's what we feel it's our responsibility to be prepared to do. As we look at these 3 levels, what they mean across the system is simply, if we're in yellow, low community spread, schools can be open up to 100% capacity. So students are welcomed in, we're running our program, our buses can run at their typical capacity. We're all using all of those mitigation strategies we've talked about. We are increasing our sanitation and cleaning protocols across the board. Things like, typically we would clean the bathrooms at the end of the day after students are done using them each night. Now we'll be cleaning them throughout the course of the day, things like that. Look at restrictions on congregating and congregation size. And we have to look at our extracurricular activities and things and see what make some decisions around what's appropriate, what's not. And if we move to orange and moderate community spread, all of those things are still in place, but we're reducing the capacity in our buildings by about 50%. So we're implementing essentially what people call a hybrid, and I'll talk about that in a moment, which would mean our buses are at a lower capacity because fewer kids are coming in. Again, all the other things are still in place. And we look again at anything that's running extracurricularly and make some decisions around that and go from there. If we go into the red, into the high community spread, then our schools are closed to students for instruction, but that doesn't mean that we're sort of closing them to everyone. So even in the moderate and in the high, if we have some students who need to access personalized services because of special education services or English language services or others, in any one of these modalities, those students may still be accessing the school. If we're in a hybrid, they may access it every day. And by doing that, we make sure that we continue to provide the education that our students need. So and then of course, if we're in red, we would suspend our extracurricular activities across the board. So going a level deeper, looking at the low community spread model, again, we look at the face-to-face instruction with our students in the classroom. We may have some that opt for the remote learning, okay? And we may have some who don't feel well and so would be out for a short period of time. So in order to accommodate all of this, we're going to a model where we're live streaming our classes securely out for our students who are in remote locations. So if a student's on remote learning, then from day one, or if they're on a hybrid, they're going to be expected to log into their classroom when that class starts. They're going to be following their typical high school schedule. They would log in, they would be there. They're not necessarily going to be staring at a screen all day. And when I was asked this question at the press conference on Monday, I explained that it's not a solely synchronous model. It's a mixture of synchronous and asynchronous, more of a blended model, because we're also integrating in across the board the use of a learning management system, which helps it to be more of a blended model. So students may be logging into a class to watch the instruction occur, to be a part of that, whatever that craft lesson may be, and then they may log off to do something with that, and then may come back in to share. I mean, I think the simplest analogy is in our classroom, students don't just sit at their desk and stare at their teacher all day. So from their home, as they're live streaming in, they won't just be sitting there staring at the screen. They'll be actually doing things with the material and then coming back. The LMS provides for that communication back and forth between the teacher and the student, you know, using Schoology. And there may be times where for collaborative work, the teacher may go onto the live stream and create breakout groups and have students working with each other if there's many of them, or just everyone on the screen may just become a group to do some work together where they're seeing each other on the screen, but they're also doing other work. So this is a model that we're developing. It's something that we're confident will work and will be successful for our kids and our staff. And it's something we know we're going to get better at as we begin and continue with our implementation. So that's in the low spread model. And of course, if there's a classroom where everyone is present and no one's on remote, we wouldn't stream it, right? So the idea is that for one or more of our students who are on the remote learning, we'll stream that for them to be able to come in. And again, it keeps them apace with what's going on in the room, because we may have students who opt for remote in the beginning and then join us, or vice versa, maybe with us in the beginning for their own reasons, opt out, and then we'll have, again, those that may have to be out for a day or for a temporary longer period of time. It accommodates all of that. It also may accommodate teachers who need to be out for any reason. And teachers that we're encouraging students to stay out if they're not feeling well, and we're encouraging teachers to do the same. So there may be times where a teacher may be teaching a lesson from home, and there'd be a substitute teacher in the room, and the kids would be logged in, or the teacher would be up on the whiteboard, and they'd all be together in the class while the teacher is live streaming in. So it allows us, again, to continue with our instruction in a variety of, being able to face a variety of different challenges. Let me say it that way, okay? So that's the low spread environment. The moderate spread environment brings us into what's called the hybrid. And for this, we're looking at developing 2 cohorts. Now the schedule may change a little bit, you know, as we think it all through, but right now, as we put it together in this document, we're looking at 50% of the school community. It breaks at about A through K for cohort X and L through Z at cohort Y. Now, this doesn't, if we were to go to a hybrid, it doesn't mean that classes would be 50-50. Whereas if you have a class of 20, there'd be 10 on one day, 10 on the other, because we're not able to do it with that kind of granularity. What we want, we could have done that, but we really think it's important to keep families together, because we may have a high school student who has siblings in the middle school and the elementary school, and we'd like them to be moving on the same schedule as possible. So that's why we looked at it alphabetically. Again, the approach right now is alternating days, but we're looking at some information around this to make the best decision. And it may be ultimately a high school has to look a little bit different than K-8 because of just the nature of learning and the students and what have you. So we're working through all of that. But the idea of a hybrid essentially is it reduces by about 50% the daily capacity in the buildings, which then really serves to strengthen the mitigation strategies. And that's the key. So when you have fewer kids, the socially distanced, they're more socially distanced. The cohorting works a little bit easier. The mask wearing is more effective. You know, all of those things just become strengthened when you reduce the number of people in the space. And of course, we continue the remote learning every day for folks that have made that choice. Otherwise, the students would either be in for face-to-face or home and on the live stream. But instruction continues every day as this goes on. We hope not to have to use this model, but it's entirely possible we will, as we know, as we are in the midst of a global pandemic, and we are learning new things and reacting to data as it comes. So if we do need to go to a high community spread model, that is the model where our schools are no longer open for students to come in. Our staff may come in to teach from their classroom, depending upon where we are as a community and as a county. If home isolation recommendations or orders are in effect, that'll influence our thinking here. But we would go fully remote. And again, I just want to reiterate, the experience would be different than what the experience was in the spring. In the spring, we were literally, well, not literally, but truly flying the plane and building it at the same time. We've had all of that experience now to apply into what we're doing. So we've spent time learning more about the live streaming. We're spending more time learning about the LMS, the Learning Management System of Schoology, and how to make this work for kids. So we've spent our summer learning this. As you're going to see in a moment, we're bringing our teachers back a little bit early so that they have more time to learn more. We're bringing our kids in a phased approach so that they can learn some of this. All of it is really being very purposefully done so that we are prepared regardless of what modality we need to go into. So to onboard in the beginning of the year, we've made a couple of changes. Essentially, what we're looking at is our teachers and our faculty will be in for a full week prior to the start of the school year. So from the 24th through the 28th. And those days, they'll be in personal. They're going to be coming to the school. Their PL, some of it will be online, virtual, and some of it will be in person. Again, when I had a meeting on Monday with the governor and some others, we socially distanced, we sat together, we had the conversation. I could see the same happening with small groups of teachers, doing that work together, and that's perfectly fine. So it'll be a mix for them. On Monday, we begin with our kids, and we're looking at bringing 50% of our kids each day over the first 4 days. Again, this model may change just a little bit, but the idea is that each cohort of kids will have 2 days in school over these 4 days so that they get to know each other, they get to re-engage with the school, get to know their teacher, go through and really learn the safety protocols that we're putting in place. But what we keep going back to as we talk this through is our students and our teachers, our staff have not been in the building since March. So we want to make sure that we provide the time for our teachers and our kids to re-engage with school, and knowing that school is going to feel and look a little bit different, maybe a lot different for kids than it did when we left in March. We're going to have things, one-way hallways, a different schedule, longer passing times because of the one-way hallway. Lunch is going to be different. We're going to be using the outdoors, we're installing tents in different places to encourage students and classes to go outside wherever possible. It's going to be different. So we want to give time for students and teachers to get used to the environment and to get to know each other, because we know that our schools are important because of the education they provide. They're equally important because of the social emotional supports that they provide. So we want to really bring our students in a phased approach. The 5th day, according to our modeling right now, is bringing all of our students in. Although I want to be clear and upfront that we're looking at that still. We want to make sure that that's the right decision. With the governor's flexibility, we're going to continue looking at it. We'll look again to see where the level of community spread is, not just at a state level, but at a county level. And we'll look again at our implementation of the mitigation strategies at the high school and make an informed decision about that. The governor's guidance originally was about all students back every day, full time. And so that is what we've been working towards. And that is our goal. We want our kids back. We just need to make sure that what we do is the right decision along the way. We may wind up phasing the high school out longer. We'll take a look. But when we'll keep communicating with you around these decisions. And we also recognize, like, this is the last day of July. It's the last day of August is when we start. So we've got to stay on this fast timeline that we've been and keep making these decisions and communicating them with you. So again, I would anticipate sending a text out, if not an email out, when that decision is made, and directing everyone to go take a look at the website as well. Okay. We mentioned briefly the cohorting. I don't want to go into too much in detail here because, again, the challenges around the high school with cohorting. I do want to take a moment just to talk about transportation. Next week, a survey is going to go out to all families asking for just some quick feedback around anticipated need for transportation, and then anticipated choice, if you were to choose today, of face-to-face instruction or remote instruction. This feedback is going to help us as we finalize our plans prior to making that final decision. Understanding that transportation is a mandatory accommodation provided by the district, meaning if you say today that you don't need the bus, but then a couple days later you do, let us know, and we're going to start sending the bus to get to you, because it is an important way that we ensure that everyone has equitable access to our programs in education. So same goes with deciding to go into remote learning. I mean, you can decide in the beginning and then change your mind. Again, we're public schools. We welcome our students with open arms. The steps we're taking on the buses include mask wearing at all times. Every student on the bus has to wear a mask all the time, unless it's a one of those few exemptions, and that would be few and far between. And that's all outlined by the CDC. We look at spreading kids out as much as we can. We hope to have a hand sanitizer on all of our buses as kids get on, and we drive with the windows down to keep the air moving through those buses as we go. But if people can be driven to school, that's certainly an option. And in order to help facilitate that, we're working with the town to build a road through the high school that goes into Waveney, so we may be changing the traffic flow in the morning, where you pull in from the farm road side as normal, but drop off around the loop and then keep going out and go out past the tennis courts and go out through Waveney. We have gotten the approval that we've needed to get this going, and I'm optimistic that we'll be able to get it in place, hopefully by the start of the school year. That will help. It'll help everybody. It'll help our kids. It'll help our parents, help our staff, because we're not going back out onto Farm and South and really bottlenecking there. So people will be able to drive right through and then go left or right, depending upon where they're going once they get into Waveney. So that should help with the flow. We've got, again, the buses, like everywhere else, those mitigation strategies we're talking about are in place until we get back to the green, which is sort of the pre-COVID days. The face coverings I've mentioned, again, everyone in the buildings expected to wear it unless they're taking a mask break, and they can only do some kind of a mask break with supervision if they are following the social distance and other guidelines that we've been talking about. There may be times where teachers, if they're instructing, if they can maintain the social distancing, it's okay for them to take off their masks, but in that instance, they may put on a face shield, things like that, like we've talked about a little bit. The decision around canceling classes, remote learning, reopening plans, now that'll be guided by what the state just published, and they're going to be continuing to refine. And I'm meeting with the task force again on Monday night to share feedback and make some final adjustments or more adjustments to it. But I just again want to reiterate the fact that it's going to be data driven. And we are looking at and developing plans with our very talented nursing staff and others around what do we do if there is a positive case? What does that look like? What is the what's the decision tree that we use to determine who stays and who doesn't and what have you. So all of that is coming together, and all of those protocols will be clearly articulated. In the spring, when we closed, one of the big concerns that played out was we didn't have a mechanism to know when we were ready to return. When is it okay to go back to school? And so working with the CDC, using their guidelines, and then working with our local health department, we're going to be also articulating sort of that return, because we know what would put us out. We need to know when we're ready to come back. Again, those state metrics will be helpful in levels of community spread, and we're looking to refine that even further at a local level to make those determinations. The question around who has to quarantine, it comes up all the time, so I'll just cover it quickly here. The CDC guidelines as of today, and again, these things change, but as of today, is really anyone who's been in close contact with someone who's tested positive for COVID-19. And close contact is defined as someone within 6 feet for 15 minutes or longer, okay? So that's important, because it's not students who walk past each other in a hallway. It's students who are in close contact, and 6 feet is relatively close. 15 minutes is a pretty long time. So our nurses and others will be have been trained, and more will be trained in contact tracing and what that looks like. But we're going to continue to follow the CDC guidelines. Now, in the elementary school, a positive case with a cohort, we can put a cohort out and keep the building running. It's, again, a little different at the high school. So, we're working with our nursing staff and the town and district medical advisor and others to develop exactly what that looks like. But we are guided by the CDC, recommendations. So with that, I'm going to take a deep breath. I'm going to allow a moment for questions to pop up into the Q&A. Again, I encourage you to scan and take a look at other questions before asking your own, so that you can upvote instead, which could rise it to our attention. And before we go into the Q&A, just to stress, we learn more and more every single day. We've all been engaged in this work for a long time. Since again, the day we closed, we, committed ourselves to learning and to making decisions based on the information facts that are most current. But there may be questions we can't answer today. And so what we'll also be doing is developing an FAQ that, based on the questions, that we'll put on our website that you can continue going back to, as I mentioned before. So I'm going to stop sharing and turn it over to Dr. Carenti while I take a sip of water.
So Brian, if you want to take a quick break, I can answer the question about SAT and ACTs. But the next question is really trying to explain to the parents about how we go from low community spread, moderate community spread, hybrid, and are those decisions being made on the numbers in New Canaan? Are they being made by regional decisions? So if you could talk a little bit more about that in a minute, that would be great. There is a question here about SAT and ACT. So we do plan on administering the SAT and the ACT as it stands now. And we'll be working with the custodial staff as well as the high school staff as far as what spaces we'll be utilizing and then how we'll go about cleaning those spaces when the test is finished. So we have no plans in changing that.
Great. So the low, moderate, or high community spread levels. First, they haven't decided yet how to break this up, but the recommendation from the task force that I'm on is that we look at it by county. And that is what Governor Lamont said the other night. So I believe that that's what they're going to wind up doing, is making sort of those community spread determinations looking county by county. So we'll be in Fairfield County. They looked at other things, but they were disparate, and they think counties do sort of move together. But ultimately, it's important to note the decision will be made locally around what it means for us, right? So as we looked at the models that are here, the level of community spread, if we do move from yellow to orange, then we would be talking about what that means as far as the hybrid and the models and the things that we're putting in place. So the districts have the flexibility to make the decisions locally, and ultimately it winds up being, it becomes the responsibility of the superintendent, to be frank. But I would be making that decision in consultation with all of those experts I mentioned before. But the specific modeling and the experiences for kids would be making with, alongside all of our administrators and faculty and parents, and getting feedback around there too. But the ultimate decision is made locally.
Great.
So
Will one of the high school administrators address how lunches will be handled? And I know that we're still trying to work through all of those details, but if you could give some indication about how we might be managing that, that'd be helpful.
Sure. We're going to have tents outside during lunch. It's going to be some grab and go, limited menu to move things pretty quickly through. We'll still have seating inside, but we'll have significant seating outside for students as well. About 27 minutes in between each lunch wave so that we can clean the spaces, and we have a fourth spot. We're leaving one of the spots free so that we can do a deep clean to really make sure our custodial staff has time to get in there and work and make sure all our spaces are clean for kids. I believe it was about 26 minutes or so, or 27 minutes for lunch hour. I don't have it in front of me, but ultimately they have a little bit more time than they normally do, and they have more time in between to get to their next class as well.
Great, thank you. Brian, can you respond to snow days? I think there might be some confusion because the school year is being shortened. Will there be snow days? Will we no longer have any snow days?
There we go. So I would hear the question to be, if we're on snow days, can we be on fully remote learning and still count it as a day? Good.
Right, and then there's also a question about because we're shortening the school year.
Sure.
So does this also mean there will no longer be snow days, so that has been considered for shortening the school year?
So first I want to credit the person who asked the question, because that's really thinking ahead, and I love that. What the commissioner has done right now is and working with the State Board of Ed and the governor, they've reduced the required number of days. It's always been 180. They made it 177. And now they're saying, look, if you open in a hybrid and it's approved, they've reviewed it and what have you, then those days will count as you're in or out. As far as the, so that if you've got 50% of your kids coming in, then the 50% that are home, that's a school day. So they haven't really shortened it. What they've done is said that the students on remote learning are still counting, as a school day. Currently, unless there are extreme circumstances, they're not encouraging districts to go fully remote. They're saying anyone who does needs to really have a clear rationale, sit down with a commissioner and a task force that he's putting together, and ultimately they would get feedback from them. The models we're looking at are between the hybrid or the 100% in based on local conditions. But right now, the conditions don't warrant being fully remote unless there's something that's kind of very challenging in a local environment. Because of that, if we have a snow day where half of the kids wouldn't be coming in, it's a great question around, can you do a remote learning day for that full day? We'll get some clarity on that when the time comes. Right now, my expectation would be that it may not count as a day if it's fully remote, but I'd be glad to advocate for the other one. We've been advocating at the state level for a long time, actually, to allow us to use remote learning on snow days and count them as days. My colleagues and I, we've written papers to them. We've shown them why this works. There are states that do that successfully. I believe Illinois is one of them, where they have kind of a snow bag, or they flip into a certain lesson when they have a snow day, and that day counts. So that's one of the things that I hope comes out of this whole experience in the end, is that Connecticut sees that we can use that time well, and that they should count as days towards the 180. I don't want to overemphasize the 180 because we're in such an unknown environment that we want to maintain, be flexible in what happens. Right now, with the way that we're phasing in, we are at about 178 days, I believe, overall, with the 4-day flex in that we have, because we do 182. I think counting days, these things can change based on the environment. So I think we just need to be, we'll just stay nimble and flexible with all of that.
Great. For the high school administrators, in the past, the students had some flexibility to change their schedule after the first day of school. Will the students still have this option if needed?
We're going to work with students as much as we possibly can. There'll be a little bit less flexibility than we probably had in the past, to be quite honest with you, because our class sizes, we're trying to keep it certain levels, but we're always going to work with our kids. We love our kids. We want them to succeed as best they possibly can in school. But it really may depend on what the schedule looks like and what the classes look like.
Excellent. Dr. Lutzy, can you talk a little bit about possibility of air purifiers or the ventilation system at the high school?
Sure. So at the high school, we have the good fortune of having a large ventilation system that we can adjust and balance to exhaust out, and creating a bit of negative pressure in each of the rooms. That's the recommended sort of work as we're doing it. So we have an engineer coming in next week who will go into individual rooms, and they actually come with a device that measures air exchange and frequency of exchange. And he's been working with us to balance that system out at the high school. But given the renovation that occurred back in around 2006, 2008, it's a new system that works very well. As compared to many schools that use what are called unit ventilators, that are the recycling only, essentially, that are those units underneath the windows. So the high school is in good shape with the system that it has and the ductwork that it has. We are, of course, looking at putting in the densest filters that the motors can handle. You can't put in a filter that's so dense that it reduces the airflow. So it's identifying and installing those filters across the board, putting those in. But I will say the ventilation is something we have really been committed to and working on for months. We're very, very well ahead of this part of the issue as we're learning about it. And those daily EOC calls that occurred for so long, talking to Dr. Pierce, Dr. Reed, and learning everything that they could share with us. So I believe we're in good shape at the high school with ventilation due to the system that we have there. And those are those steps that we're taking.
Excellent. For a high school administrator, will the grading policy be the same? What will it be, or will it be changing based on if school's in session, hybrid model, or full remote education model?
Right now, we plan to have the same grading policy. uncharted waters. So we'll see as time goes on. But right now our plan is to have the same grading policy, and obviously we'll see as time goes on.
Great. There is a question about temperature checks for when students are coming back to school, particularly the first 14 days of school, given that people have been traveling out of state.
Mm-hmm. So we are working with our insurer and others, and we're trying to set up an opportunity for staff and for students, voluntary of course, to go and be tested and get the results quickly the week before our teachers return to school. A couple of weeks ago, it was more of a sure thing. Now it's a little more challenging. Insurance companies have changed their approach a bit, and some of the equipment has actually been requested and moved down south where the outbreaks are as bad as we all know. So that's a good thing in some ways, but for us, it hurts us because the system we had been working out is becoming a little more challenging. But we're hoping still to be able to do that, and we are also working with the hospitals. I believe it'll be Stanford Hospital, maybe even a local provider, to set up a hotline where anyone who is worried or shows symptoms or has any reason for concern can make a call that day, go in, get a test, and within 24, 48 hours, get the results. So, we're working to get that set up so that it's very easy for families to do, and still optimistic, although cautiously so, about a testing opportunity for everybody.
Great. Brian, did you consider using the hybrid model for at least the first 2 weeks to assess conditions before going to 100% capacity? And is that a possibility?
It is. As I mentioned, we need to stay flexible in our consideration here as we're thinking about the best way to do all of this. The onboarding plan, the 4 days, we felt was a good start. And I think we do always have to keep in mind where we are with our levels of community spread. If we are at a 1 or a 2, as we are now, sort of this below 10 per 100,000, we want to make sure that we keep that factored into our decision making. So want to be fact-based in what we do, but that's a possibility. We're looking at that as a possibility. It may be maybe 2 weeks, maybe a month, or maybe the 4 days are enough. So we're not yet going to be announcing our plans. We had to put something together. We wanted to put it out for conversation's sake. And to get feedback, and that's what we're doing. I think the purpose of going the 50% in large part is about reacclimating people, teaching them those safety protocols and giving an opportunity to know each other. So if that's really the driver, then I do think there's an argument to be made for the 4 days and then getting everybody in.
Great, thank you. There is a question during remote learning, what accommodations will be afforded to those students who have 504 plans? And certainly those are individually based. And so you'll be working with your guidance counselors and certainly your grade level administrator to make sure that the accommodations are appropriate for any child who has a 504 plan and may be in remote learning. There was a question about live streaming and hybrid. So I lost the question here because something popped in, but the question is in regard to live streaming, so I can certainly respond to that. So the point of the live streaming is to help keep the instruction fluid. So if you're in the low community spread, you'll be live, everybody will be in school. There might be students who've opted out of school, which will be remote learners, and they'll be having live streaming. The live streaming is interactive. The teachers will obviously establish guidelines for when do you interact and when do you listen to what the lesson's being done, and then they'll come over and talk with the kids that are in the live stream. There will be times where they're gonna actually all put their computers down and do an activity or complete an assignment that's been assigned to them. When you go into hybrid, once again, live streaming will continue. So the kids that are at school will be receiving the live instruction, and then the students who are at home will be receiving the live streaming. And then as we move into remote, this is what will help to keep it fluid. We are looking to do much more synchronous instruction as we move into the remote, so that if we have to swing back into the hybrid, everything becomes flexible and fluid.
Yep. And just, I see 1 or 2 little things here, so I'll just jump in, Jill. The model does not have every student coming in on a day if we go to a hybrid. It's always 50%. It's not all in on Friday. So the idea is 50%. We are looking at, we've had to make some hard decisions, right? One is that one of the foundational values of our community is volunteerism and involvement in our community involvement. And yet, given all that's happening, we're not going to be able to have parent volunteers coming into the school. We're not going to be having PFA meetings in the school and other things while school's in session, because we really need to minimize as much as we can folks that are coming and going. Similarly, we're going to be teaching many classes outside. So we're actually looking at closing the campus to outside visitors during the day. And I know people like to come walk on the track, and a lot of people love to walk their dog around the building and what have you. But we're not going to be able to do that next year because we're going to have kids out there in their outdoor classrooms. So we need to be able to secure that. But at the same time, we are still going to keep our open campus policy. Bill, if I'm correct on that, just shake your head. Yep. So it is our plan to do that, because we also know if students have a free period and they've met the requirements in order to do this and they're responsible, they want to go home, they want to go do something else and come back, I think that's all the better. Let's not keep them in the building if they don't need to be. Let them go and come back for whatever's next. Also, if they have a first period free, they would come in later. If they have a last period free, they could leave earlier. With a block schedule, that becomes an even more significant amount of time.
And even with the long periods of time off, some of the blocks are bigger. A parent may choose to take their child home, even during the middle block 2 and 3, and sign their child out of school and take them home. So that's another function that can happen with a longer period.
Yep. And the signing them out of school would occur outside of the school building.
It's correct.
It's another thing we're working on.
And it also won't be as free. There won't be the free spaces that there have been traditionally in the past. We're looking for students that are still at school to find a place to kind of keep them socially distanced and but it's not going to be as free as it has been previously. It just can't be.
Right.
There is a question in regards to teachers returning. I think it's because the survey that went out among the state. And I know that Mrs. Pianca is not here today, but she did answer yesterday that we don't have a percentage of how many teachers will be returning, but we are working with possible individuals that might have an autoimmune or a health compromise. But right now we have a very small percentage of people that we're working with, and that's going through our HR department. Mrs. Pianca is our director of HR.
Yep.
So there are still many questions here that have not been answered, but we're getting late in the afternoon. So what we've done for each of the sessions is we will make a copy of all of these questions and do our best to answer them in some frequently asked questions and post it onto the website.
Perfect. Yep. Yeah, I think that's great. I can't help but scroll through the questions. Again, the decisions. Yeah, we have the statewide guidance, and then we may have one high school or one building in a hybrid while the other schools are fully in. We may, if we have to cohort a group, could have a class with the second grade who's staying home and they need to be cohorted while the other classes are still attending. All those details are being worked out, but that's the fluidity of the model we're talking about, because we don't want one positive case to shut the whole thing down, unless that's the right thing to do. But we need to think all of those options through in advance, and that's what we're doing now. So I hope this has been helpful.
I know there's so many wonderful questions here, and we will do our best to answer them all. So
we will, and our get in touch. Keep us posted as we go. There are lots of questions. We try to answer as many as we can. I try to use every opportunity. But once we get off this call, I'll be answering a whole list of questions for a local reporter that I'm sure he'll get out the next day or two, and I always try to make it as useful as possible for everybody. This video will be posted on the website, and we'll have more opportunities for us to talk together and to do some Q&A. So we're really so grateful that you put this time aside on a Friday afternoon. Hope that you can take a deep breath and unplug and just think about enjoying your night and your weekend here, and re-engage with this in the next week as we continue to approach the start of the school year. But the most important takeaway here is just to reiterate that the safety, health, and wellness of our students, our staff, and the community will guide and drive our decisions. They will, and that's saying a lot when you really think about what that means. But we've always made our decisions in that way, and we'll continue to do that. So stay tuned, and we will keep communicating through the website and updates as we can. So I'm going to stop recording now.